over the last year, we've seen the obvious and disproportionate impact that the pandemic is taking on women personally and economically. And some are even calling this situation a she-cession, as women are bearing the brunt of job losses and increased caregiving demands. So just thinking about beyond the numbers that we're seeing in media and the reports that are coming out, maybe you can share with us what you're seeing on the ground. What has the pandemic meant for the livelihoods of the women that you work with, and how have their livelihood strategies had to change as a result of the pressures that the pandemic is putting on them? Maybe we can start with Toni in Alberta.
Absolutely. For the women who access our services, they've had to make impossible choices amidst this pandemic, absolutely impossible choices. They've had to choose between paying rent and feeding their children. They've had to choose between having lack of resources and fleeing abusive relationships. They've had to choose between working or keeping their kids in school. It's been an impossible position that they've been placed in through no fault of their own.
Thanks, Toni. Fay, how does this compare with what you're seeing with the women you're working with in Toronto?
Well, with the migrant women that I'm working with, there have been two very different experiences. One is of women who have lost their jobs entirely because they were working for people who themselves lost their jobs or who are now working from home. And so for migrant care workers, they can't afford to retain them. So those women have lost their jobs and lost their homes, but are also stuck in limbo where they can't regularize their immigration status or return to their home countries because of travel bans. At the other end of the scale, there are women whose jobs have completely intensified because they're doing even more work under even more precarious circumstances than they were previously. And again, if I give the example of migrant care workers, there are care workers who have essentially been under house arrest in the homes of their employers since the pandemic began. And the way that their mental health has been absolutely destroyed, along with their precariousness economically, has been devastating.
Leah, you also work with precarious status and undocumented women. You're doing this work in Montreal. How does this resonate with what you're seeing?
Well, I think that's the perfect word for it. I mean, really devastating in a word captures the impact that the pandemic has had for so many of the precarious status women that I work with. That we've also observed similar things to what Fay has just described for the women who are working in the informal economy. And I would say, likewise, for those who are in the formal economy, likewise to what Fay had just mentioned, they've seen these impossible expectations put on them. And it's meant for them choosing between their own personal health and their livelihood. And it's worth noting too that the vast majority of the women that I work with are in essential service sector, and they don't necessarily, with temporary residency, have access to permanent status, or even in some cases have access to healthcare. So that really brings in a whole bunch of questions as to how we're truly treating the people that are on the front lines of this pandemic.
Thanks very much. So what we're hearing then is that the pandemic has not just brought about new challenges for women, but it has exacerbated existing vulnerabilities. So it would seem that if we want to pandemic-proof our society going forward, it's the underlying conditions that we would need to address. So maybe going back to Toni in Alberta, what do you think that the women that you work with would have needed before the pandemic that would have helped them to weather the storm that we're currently in?
That's a loaded question, but I have the top three things to pandemic-proof the circumstances in which our women are living. Probably the overwhelming number one is a universal basic income. That is critically important to that resiliency in moving forward. Number two is universal childcare. Our women should not have to choose between, caring for their children and working. That should be something that they have access to and supported around, as we can't ignore the generational impact of global crises like this. And number three is access to the internet and having a computer. The world went virtual very quickly and left many, many people behind. So I think that's very critical in moving forward.
Thanks very much, Toni. Leah, are there specific things that the women that you work with would have needed to make it through with more safety and security?
So I completely agree with everything that Toni just said, and I would add to that list because a lot of temporary status migrants and precarious status migrants aren't included in things like income support. What I would add would be permanent residency. I think that's the kind of short and most actionable answer to this big question. However, I do feel a bit cautious in saying that permanent residency is a solution to many of the problems that we're seeing, because it's obviously just one part of a much bigger project that we need to undertake as a society if we're going to truly address the economic security of women. Of course, we would want to see better labor protections and labor conditions and social perception even of essential service workers. We need to really come to terms with the critical role that they play in our society and to value it. But that again is to just one part of this much bigger challenge that we're facing. And so moving forward, I would say that I'm not super great at coming up with solutions. I'm really much more seasoned at pointing out problems. But what I would hope would be that we move towards an economy that is based on inclusive feminist principles and that reimagines not only the way that we work, but also how we redistribute wealth and power.
Thank you, Leah. Fay, is there anything that you would add to that list? And what do you think all of this tells us about where we need to go? I think Leah already started us in that conversation, but where do we need to go as we rebuild?
I would absolutely agree with permanent status on arrival for all migrants and regularization of status for everyone who is here in Canada, and paid sick days. How can we, a year into the pandemic, still not have paid sick days? But what we need in going forward is an economy that is actually premised on human and human well-being and the well-being of the natural world of which we are a part, not something that is focused on profit maximization. We talk as if we have the values of human well-being. We talk about essential work, but the way that our economy is structured is not actually designed to prioritize that or to deliver it. So what we are seeing in the pandemic is exactly the precarity, the dehumanization that the system is designed to create and to use in a functional way to profit some, not others. What we need is an economy that truly leaves no one behind.
Thank you very much, all three of you, for sharing your time and your thoughts and expertise with us today. I know there's a lot more that could be said about what you're doing and seeing in your communities and where we need to go next. So thank you for giving us a window into all of this for us.